Hello, now I will discuss about a special case of chest X-ray. Here, it is a diagram of a view of chest, and it is the right side, and length of both clavicle are most more or less equal, so positioning is normal. And these are the scapula, these are the rib shadow, and these are the bronchovascular marking. Here, you can see the cardiothoracic ratio is more than 50%. So it is a case of cardiomegaly, and some hilar markings are prominent. So it is a case of CHF also. And if you see here, here you can see the straightening of heart bladder. Straightening of heart bladder is the special feature of mitral stenosis. In mitral stenosis, pul- pulmonary due to uh, uh, overload, left at left atrium is remains here, and due to overload, left auricular enlargement occurs and pulmonary trunk hypertension due to pulmonary hypertension. Pulmonary trunk also enlarge, and so the this left heart product becomes straight. Okay, and another thing you can look here. This is right side. This is enlarged, and one this and another this. You can see that it is called double density sign. This double density sign is a feature of left atrial enlargement, and here you can see it is here mitral valve places, and here a ring is there, means mitral valve prosthesis, mitral valve replacement done, and mitral valve uh, is replaced, and these mitral valve prosthesis is implanted, and these rings. These are for the suturing of the for for a cardiothoracic operation. Okay, thank you.